Hi, I am Linda, welcome to this video. In today's fast-paced world, our bodies often bear the brunt of our busy lives. Aches and pains have become a near-universal experience, whether they stem from intense physical activity, age-related joint wear, or the everyday stress of modern life. No matter the cause, seeking relief from these discomforts is something many of us have in common. I am not a medical professional, and this video only provides information. If you have any problems, you should seek advice from your medical professional. In today's video, I will explore two powerful natural remedies that can help bring real lasting relief: rosehip and atibala. They are both rooted in tradition and science, and these herbs may be just what your joints have been waiting for. I shall also explain some autoimmune disorders linked to muscle stiffness and spasms. But first, do not forget to visit my website, where you can learn more about this terrible disease. Also, do not forget to subscribe to my channel and ring the bell for more information on aches, pains and arthritis inflammation. I shall start by exploring the causes of inflammation and joint pain. Do your joints feel stiff, swollen, or achy? You are not alone. But what actually causes inflammation and joint pain? Well, inflammation is your body's natural response to injury or infection. It helps protect and heal, but sometimes, it does not switch off, and that's when it becomes a problem. The problems could be: 1. Autoimmune conditions such as rheumatoid arthritis, where the immune system attacks healthy joints. 2. Osteoarthritis, wear and tear of the joints that triggers low-grade inflammation. 3. Infections like Lyme disease or viral arthritis. 4. Injury or overuse, if you do sports, repetitive movements, or strain. 5. Gout is another type of arthritis, and it is caused by uric acid crystals in the joint. 6. Lifestyle factors. If you have a poor diet, stress, obesity, and lack of movement can all fuel inflammation. The immune system's job sometimes gets confused and starts attacking joint tissues instead of protecting them. This creates chronic inflammation, leading to pain and damage over time. But there is some good news. Managing inflammation is possible, which includes: eat anti-inflammatory foods, stay active with joint-friendly movement, manage stress, and work with your healthcare provider for the right treatment. Let's begin with rosehip. Have you ever noticed those bright red or orange berry-like bulbs that appear on rose bushes after the petals fall away? That's rosehip. The bright red fruit of the wild rose plant, also known as dog rose, is used traditionally in European herbal medicine. Rosehip is now recognized for its potent anti-inflammatory and joint-protecting benefits. It usually appears in late summer and early autumn, and has been used for centuries in traditional medicine. It's packed with vitamin C, flavonoids, antioxidants, and anti-inflammatory compounds, and is known for its potential health benefits, especially joint pain and supporting immune conditions. These elements help reduce inflammation, fight oxidative stress, and support cartilage health. Clinical studies have shown that rosehip powder can reduce joint pain, improve mobility, and even lower blood CRP levels, an inflammation marker. Rosehips can be found in several forms, such as tea, powders, capsules, and even oil. They are often used as a natural remedy for osteoarthritis and promote healthier skin. It is a powder mixed into smoothies or yogurt, in capsules for convenience, or brewed into a tea using dried rosehips. Always look for high-quality supplements, ideally with GOPO content on the label. But just like with any supplement, it's important to check with a healthcare provider before adding rosehip to your routine, especially if you're taking medication or have health conditions. Next, we turn to atibala. This herb, scientifically known as Abutilon indicum and commonly referred to as Indian mallow, is a small shrub native to tropical and subtropical regions. This plant holds significant value in traditional medicine systems like Ayurveda and Siddha, where various parts, including the roots, leaves, seeds, and flowers, are utilized for their therapeutic properties. Atibala is known for its cooling, laxative, digestive, analgesic, anti-inflammatory, astringent, diuretic, expectorant, anthelmintic, aphrodisiac, and emulsant effects. The plant has been used for centuries to reduce pain, support muscle strength, and ease inflammation. Atibala is especially helpful for people with fatigue, joint stiffness, or weak muscles. In Ayurveda, it's said to pacify Vata dosha, which is often behind joint degeneration and stiffness. Atibala, or Abutilon indicum, is a herb used in Ayurveda for its anti-inflammatory and pain-relieving effects. It contains compounds like flavonoids, alkaloids, and tannins. This herb can be beneficial as it can soothe inflamed tissues, relieve muscle and joint pain, help with swelling from injuries or arthritis. Atibala is especially helpful for people with rheumatic conditions, and it's often used in oil form or as a supplement. You can take Atibala in 3 main ways. As a powdered herb, just 1 to 3 grams daily with warm water. As a decoction, boiled gently and sipped like tea. Or as a medicated oil, perfect for massaging stiff joints and sore muscles. Early research supports what traditional texts have said for generations. Atibala may reduce inflammation, support tissue healing, and improve flexibility. Before we discuss whether you should combine the two, I'd love for you to subscribe to my channel and click the bell icon. This way, you'll stay updated on more videos about arthritis and related topics. Should you combine them? The answer is yes. Atibala, Abutilon indicum, and rosehip, from the Rosa plant, can be combined, especially in herbal remedies for joint pain and inflammation. Rosehip, which is commonly taken as a powder, capsule, or tea, reduces systemic inflammation and supports cartilage with vitamin C and antioxidants. Atibala calms localized inflammation, reduces swelling, and helps relax sore muscles and joints. Together, they offer a more holistic, multi-action approach, supporting joint structure and pain relief. Here's a breakdown of how they work together. Question: why combine Atibala and rosehip? 1. Complementary anti-inflammatory properties. Atibala has natural anti-inflammatory and analgesic effects. It's often used in Ayurveda for joint stiffness, arthritis, and muscle weakness. Rosehip is rich in vitamin C, polyphenols, and galactolipids, which are known to reduce inflammation and protect cartilage. 2. Joint and muscle support. Atibala supports muscle strength and helps relieve neuromuscular pain, great for conditions like arthritis, sciatica, or general weakness. Rosehip helps improve joint mobility and reduces joint tenderness and swelling, especially in osteoarthritis. 3. Immune and tissue support. Rosehip boosts the immune system and supports tissue repair thanks to its high antioxidant content. Atibala helps balance the body and soothes irritated tissues with its demulcent and cooling nature. Ways to use them together. 1. Herbal tea. Mix dried Atibala leaves or powder with dried rosehip. Soak in hot water for 10 to 15 minutes. Then strain and drink 1 to 2 times daily. 2. Capsule or powder blend. You could combine equal parts of powdered rosehip and Atibala. Take half a teaspoon with warm water, or as directed by an herbalist. 3. Oil infusion. For external use you can also infuse both herbs, and use them to massage sore joints or muscles. Taking them together, internally for inflammation and externally for targeted relief, can be very effective. Both are generally safe, but if you're pregnant, breastfeeding, or on medications, especially for blood pressure, blood sugar, or blood thinning, check with your healthcare provider first. Rosehip and Atibala are natural and gentle combinations that help soothe joints, reduce stiffness, and improve movement. Cautions: always consult a healthcare provider before combining herbs, especially if you're pregnant, breastfeeding, or taking medications. Start with small doses to test for any allergic reactions or sensitivities. Herbs are most effective when supported by healthy habits. To truly reduce inflammation and feel better in the long term, using rosehip and Atibala to ease joint pain and inflammation is a good choice. But healing works best when you support it with the right lifestyle. You should focus on a few key areas, such as 1. Stay active. Gently moving your body regularly helps reduce stiffness and keeps joints nourished. Try walking, swimming, yoga, or Tai Chi. Rosehip may improve mobility, and Atibala may ease muscle soreness, so movement becomes easier over time. 2. Eat an anti-inflammatory diet. Boost the effects of rosehip by eating foods rich in antioxidants, like berries, leafy greens, turmeric, and omega-3s. Cut back on sugar, processed foods, and red meat, which fuel inflammation. Stay until the end of this video for more information about the foods you should eat and which are bad for you. 3. Prioritize sleep and rest. Your body heals during rest. Aim for 7 to 9 hours of sleep. Atibala has relaxing properties that may help with better sleep when pain or inflammation interferes. 4. Stay hydrated. Water supports joint lubrication and helps flush out toxins that may contribute to inflammation. Herbal teas, especially rosehip tea, are a great bonus. 5. Manage stress. Stress can trigger inflammation. Relaxation practices like deep breathing, meditation, or spending time in nature can help calm your nervous system and improve the effectiveness of these herbs. 6. Be consistent and track changes. Natural remedies take time. Take your rosehip and Atibala regularly, and note any improvements in pain, stiffness, or energy, but always consult with your healthcare provider before taking anything new. The conclusion is that rosehip and Atibala are not magic pills, but they are powerful, natural tools that can help you manage pain, protect your joints, and feel more like yourself again. Try them for 4 to 6 weeks and observe the difference. But first, consult with your healthcare provider before you start anything new. And always remember, healing is a journey. Be gentle with yourself along the way. Combining the natural power of rosehip and Atibala with simple lifestyle changes can create a strong foundation for reducing joint pain and inflammation. These time-tested herbs offer gentle support, from easing stiffness to calming inflammation, without the harsh side effects of some conventional treatments. But true healing isn't just about what you take, it's also about how you live. When you move regularly, eat nourishing foods, manage stress, stay hydrated, and get restful sleep, you give your body everything it needs to recover and thrive. By blending traditional wisdom with daily self-care, you're not just managing your symptoms, but actively supporting your long-term joint health. Stay consistent, be patient with your progress, and celebrate every small victory. Your healing journey is personal, powerful, and worth every step. Before you go, click on my next video, and you'll explore the foods that are good for you and which are bad. Thanks for listening to my video. If you found this video helpful, please subscribe to my channel and click the bell icon to stay updated. I am not a medical professional, and this video only provides information. If you have concerns about your condition, consult your healthcare professional. I would like to know if you have any questions about this video, if you found it helpful, or if there is anything else I should cover. Just comment below, and I will do my best to respond. I hope you found this video useful. Good luck.